sit down and look at your own life and try and analyze, what are those parts of my life that I don't like? What are the habits that I wish that I could get rid of? You can change your life by taking advantage of this quarantine.
Hi everyone, welcome back. I'm Michael Sandler, your host on Inspire Nation. If you've ever wondered how in the world to get through this time and who in the world to trust, then do we have the How to Survive a Pandemic show for you. Today I'll be talking with Pulitzer Prize-winning author Charles Duhigg, the best-selling author of The Power of Habit and Smarter, Faster, Better, whose prescience has led him to write about pandemics before they've even happened and what brought us here today. And that's just what I want to talk with him about how to sort through conflicting messages, stay safe, and figure out where in the world to go from here. That, plus we'll talk about the EIS, do's and don'ts, the pandemic protocol, the American way, and what in the world is a socko. So welcome to the show, Charles. Are you ready to shine?
I am. Thanks for having me.
Thanks so much for being here and a mighty woohoo! So before we dive right into things, how'd you come to write an article for Slate last year on how to survive a pandemic?
Well, it was part of the podcast. I'm a host of a podcast called How To, and we did an episode called How to Survive a Pandemic because I've always been interested and fascinated by pandemics. You know, it's sort of an ever-present threat for us. And I had this basic question, which was, how do I know when it's time to split town? Not just in a pandemic, but in any emergency. You know, you watch the movies and the zombie movies, and some people decide to shut in and kind of close the doors, and other people decide to make a run for it. And I always wondered, how do you know which person to be? And in fact, my wife and I had gone through something similar. A couple of years ago, there was this big hurricane in New York City, Hurricane Sandy. And at the beginning of it, both of us were like, wait, should we leave town? Should we go get a hotel room in New Jersey, or do we stay home? And of course, by the time you know it's time to leave town, that's when it's too late, right? Because the roads are clogged. And so this was before coronavirus. This was before this was a real possibility. So we went to the expert on pandemics at Johns Hopkins University, but we also went to someone who was part of the Zombie Response Group, which is this emergency preparedness group. And they think, it's kind of fun to think about zombies. And we asked them, what do you do in case of a pandemic? And then, of course, a couple of months later, the pandemic actually came. And so it became a little more tragic.
And Ooga Booga. Now, my wife and I have lived in North Carolina, Emerald Isle, the southernmost Outer Banks. And we've watched as those hurricanes come in and have had to make those decisions. And we label ourselves now skittish deer. We tend to be the early adopters on these sort of things. And actually, that skittish deer term may actually be very prescient for what took place here. You wrote another article on Seattle leaders let scientists take the lead. New York did not. What'd you learn?
So that was a piece for the New Yorker magazine. And I basically had this fundamental question, which was, if you think back to the beginning of the American pandemic, if you'll remember, Seattle was kind of the original hotspot, right? It's where the first case was detected right outside of Seattle. It's where the first death occurred, the first American death. And for a long time, people were saying, Seattle, things are out of control. And then basically, Seattle got much better and New York got much, much worse. And of course, New York is still the epicenter of the American outbreak. And I began wondering why. What happened to explain why Seattle did so comparatively well and New York, things went so poorly? And what I discovered is that there's actually a science of pandemics, and particularly how you're supposed to communicate during pandemics. And a lot of this comes from a branch of the CDC, the Centers for Disease Control and Prevention, which is known as the Epidemic Intelligence Service. It was started in the 1950s, and every year a new class of EIS officers comes in, and they serve for 2 years. And as part of those 2 years, you are trained in how to communicate during a pandemic. Because when you think about it, a pandemic is as much a communication emergency as it is a medical emergency,
yes.
Right? In many ways, we know what is going on with the science. We know that this is a coronavirus. We know how it's spread. We know how long it's going to take vaguely to find a vaccine. We know what people ought to do. The question is, how can you convince people to behave in different and new ways so that the scientists have enough time to find a vaccine? And that is actually a harder question because persuasion and communication is not a science like medicine is. It's something that's rooted in psychology. And so the EIS and the CDC have spent years and a huge amount of money studying how to communicate during a pandemic so that you can convince people to do things that they don't want to do, like stay in their homes,
Right.
when, if everything goes according to plan, they don't know anyone who's sick, and hopefully they will never meet anyone who is sick.
And yet, such an interesting term, and yet, that's not how things went down. In fact, we went from EIS to CDC to silence from them, in a sense, on the East Coast. What happened?
Well, so the CDC has been shut down nationally, right? And those are the best comparison is that in 2009 was the last time that America had a pandemic, the H1N1 pandemic, which was a serious pandemic. Killed over 12,000 people, 750 school districts closed down their schools. But most of us don't remember it because the CDC playbook, the protocol, was used precisely right. And what would happen is that there was a daily briefing from a scientist, the director of the CDC, who initially was a pediatrician, and they would get up and they would give a very fact-based assessment, and people knew what to do. This obviously is a very different situation. First of all, the virus is much more dangerous than it was in 2009 with H1N1, which is an influenza virus. Secondarily, the CDC has been told not to speak to the public by the White House. And the White House communication strategy is more controversial, right? They have taken an approach that is not in keeping with the CDC's playbook. And in New York, something very similar happened. So if you look at Seattle, what did Seattle do when the pandemic started? Seattle took its scientists, it put them front and center. Instead of the politician standing behind the mic, it was a scientist behind the mic. And the scientists did a number of things. First of all, they started every statement with a statement of empathy. They talked about how worried they are and how much they care for people who are at risk. Second of all, they said what they knew and did not know, because the number one thing you want to do is maintain trust with the public. And your advice is going to change throughout a pandemic. We've already seen it change throughout this pandemic. And so when that advice changes, everyone's going to start becoming skeptical unless you have told them at the start, here's what we know and here's what we don't know, so things might change. And then most importantly, they did not prognosticate. They did not speak beyond the science. They were relatively conservative in what they were saying. And most importantly, they tried to ratchet up the sense of anxiety and panic. Now, this is counterintuitive, right? Because most of the time we think it to ourselves, oh, you want to bring down panic. And most politicians, their instinct is to stop panic from happening. But the problem is that during a pandemic, you're telling people to stay inside and to not go into businesses and to do things that hurt their own economic self-interest without them being able to see the disease around them, right? Because oftentimes the disease is located to a small group. You don't want them anywhere near that group. You don't want them to get infected. And so by raising the sense of panic, what you do is you convince people to change their behavior when they don't have immediate evidence around them that what you're saying is true. So in Seattle, that's what they did. Yeah. They would sit down and the public health scientists would say, okay, look, we want to tell everyone to stay home, but if we tell them to stay home from work right now, no one's going to listen to us. What do we say today so that 4 days from now, when we say stay home from work, people will actually listen to us? Now, in New York, exactly the opposite happened. In New York, particularly Mayor Bill de Blasio, but also Governor Andrew Cuomo, they tried at the outset of the pandemic outbreak to try and calm panic, to reassure people that this was not serious, that we were going to be able to get our arms around containing the coronavirus. And as a result, it made people less likely to change their behavior. They also did not put the scientists front and center. Instead, they put themselves behind the microphone. And one of the risks with putting the politicians behind the microphone, although in many cases we look to that, we want leadership. One of the risks, as a former CDC director told me, is that the problem is that when, for instance, like the president says something, there's a good chance that half the nation won't believe them. And in fact, they'll do the opposite of what they recommend. So that's why you never want to politicize a pandemic response. You always want to have public scientists or health scientists as opposed to politicians. In New York, they did not do that. There was also an additional problem, which is that Bill de Blasio, who's the mayor of New York, fought regularly with his own health department. He wouldn't listen to their advice. There's an ongoing fight between the Governor Cuomo and Mayor de Blasio, and that's, of course, made coordination of response much harder. And that's part of what explains why the pandemic has been so bad in New York and has been comparatively much, much less bad in Seattle. There's other extenuating circumstances, right? New York is a dense city. It has larger pockets of poverty, et cetera. But that communication element is a huge part of it.
And timing, or as Steve Martin would call it, timing, is so important here because one day, because this is exponential, something that humanity doesn't know how to, we grew up in small tribes, we don't understand exponential growth, which is really, and today it's still a huge effect as we're starting to come out that we don't understand this.
That's exactly right. One former CDC director actually estimated that if New York had instituted its lockdown just a week earlier, if they'd closed the schools a week earlier and asked people to stay home a week earlier, that the number of deaths in New York, which are now over 20,000, would be 50 to 70% lower. That's the thing. There's that old story about a beggar who makes a deal with a king about putting 1 grain of rice on the first square of a chessboard and 2 grains on the second and 4 on the third and 8, and they double each time. And of course, by the time you get to the end of the chessboard, it calls for more grains of rice than has ever existed in all of humanity's history. That's the thing about exponential growth, is that by the time you think that things are out of control, they're already out of control. You double every day.
So I hate to go there, but today we're talking about do's and don'ts and how to survive a pandemic. How do we wrap our minds around where we're at now? Because there are so many conflicting messages that it seems like every message has been watered down.
Here's the thing. There really aren't actually conflicting messages. There's one conflicting message, and then there's literally everything else. So, here's what's interesting. If you look at what the advice that the White House, not President Trump, but that the White House and CDC and state governments on the whole, state departments of health are issuing, they're all pretty much in alignment. Like, we know what it takes to reopen places. We know what criteria has to be met before we can lift lockdowns. And it's pretty straightforward. You need 14 days of a declining rate of people going into the hospital, right? You need enough personal protective equipment so that healthcare providers can do their work without getting infected. The White House has published these. Almost every single state public health department has published these. The only difference is that if you're listening to President Trump or some governors, as opposed to listening to the White House or some state governments, then you can get really easily confused, because what those people say sometimes just has to do with whatever they're thinking about that morning. So the key is there's not actually a lot of confusion out there if you just tune out the politicians and you listen to the experts, even just listen to the White House, like it's official guidance as opposed to what the president says at press conferences, you'll know what to do. It's pretty straightforward.
How do we thank you? And this is good to be able to cut through that. One of the things when it comes to politicians and scientists is there's this debate, and this is what took place in New York City, of economics versus health. And how do we sort through, is economics most important? Is health most important? Is economics drive health? How do we sort through that?
So you're exactly right. There is some places where we're actually having a conversation about trade-offs, right? And that trade-off conversation is hard. We don't like to have it as a nation. It's very important. And the truth is, it happens all the time. It's not just during a pandemic, right? When we as a nation come up with tax policy and we decide that it's good to have a lot of really rich people, and the tax system should reflect that because we think that creates aspiration, it creates entrepreneurialism. We're also saying that there's a trade-off, which is that we have less resources for people who are not going to become rich. Mm-hmm. Now, it's particularly stark right now because one of the things that we're trying to confront is the people who are most economically at risk are not the same people whose health is at risk often, right? So
particularly now.
Right now, right, during the pandemic. During the pandemic. So one of the things that we know is that young people are comparatively at very little risk for illness. They're not at zero risk, and the risk is real. There are young people who are getting sick, and they will have autoimmune problems and scarred lungs for the rest of their lives. So it's not zero risk. But by far, the largest number of the largest cases of mortality are occurring to people who are elderly, particularly over 65 years of age, and who have comorbidities. They have cancer, they have other diseases, they're obese, they have hypertension. So the question is, and for instance, I think a great example of this is Purdue University is struggling with it right now, is we are economically hurting young people by keeping them indoors and keeping the economy kind of tampered down in order to save the lives of older people who are at risk. It's interesting. The president of Purdue University said, look, we have to figure out who we have an obligation to. And at Purdue, we have an obligation to our students, first and foremost. And our students are young people. Also, on a college campus, we can control the environment pretty well. So we can try and be much more rigorous in policing who's allowed into buildings. We can take temperatures. We know where people live. We can do contract tracing much better. So what they've decided to do is they've decided to reopen the university in the fall. They're going to allow faculty, particularly older faculty and support staff, not to come to work because they're more at risk. But they said, look, students are relatively not at risk. And we know that losing another semester of college can actually have an economic impact on the rest of their lives. And that seems like a sensible trade-off. It also seems like a sensible conversation. And the issue that we need to have as a nation is we need to have that conversation, not just now. We need to have that conversation all the time. I mean, the truth of the matter is we've basically said that certain groups in America should be allowed to get sick and die at much younger ages than other groups, particularly minorities and the poor, where we know that they experience illnesses that you don't see among the affluent. And so we've already made a lot of decisions about trade-offs, some of which I think are the wrong choices that we ought to reconsider. The problem is that these are hard conversations, right? This is really what we look to leaders and politicians to help shape those conversations. And right now there's so much polarization that it's like you can't have a sophisticated conversation about like how social media is supposed to use or how people should be allowed to vote, much less like trade-offs between economics and health.
Yeah, and who knew that health on this level would become a bipartisan debate? To me, it is mind-blowing. I want to jump from the politics for a minute.
Well, the one thing that we should all recognize is
Please.
that's not new. So like if you go back to 1918, right?
Yes.
The influenza epidemic of 1918, there was a huge amount of polarization and politicization of the conversation, namely because we were in the middle of the First World War. So it's not unusual that during a moment of crisis like this, the conversation becomes politicized very quickly around health.
Thank you. So on that note, I want to switch. You're the habits guy, and I want to talk about what's a habit loop, and are there any habits that are actually hurting us during this time?
So a habit loop, one of the biggest insight that we have about how habits function is that every habit has three components. Yeah. We think of a habit as one thing, but it's really like these three things. There's a cue, which is a trigger for an automatic behavior to start, and then a routine, which is the behavior itself, and then finally a reward. And the reward is how your brain learns to remember that loop and make it automatic so that it happens almost effortlessly in the future. There's actually a part of our brain known as the basal ganglia that exists essentially just to make habits. So about 40 to 45% of our life is guided by habits. We think we're making decisions, but we're actually just having those habit loops spin inside our head. And are there bad habits right now? Yeah, there's always like good habits and bad habits, right? In every part of life. I think that one of the things that's interesting about right now is that this is an opportunity when we know that a lot of people can change their habits and build new, better habits. One of the things that's interesting about habits is that they tend to become automatic. Our brain literally shuts off when we're in the grip of a habit loop. But what's interesting about it is that they're also incredibly delicate. When you change someone's environment, their habits become destabilized in a way that it's very easy to shift. That's why one of the best pieces of advice to someone who's trying to quit smoking is to give up smoking while they're on vacation. Because when they're on the vacation, all their old cues are gone. Everything is kind of up for grabs. It's easier to make it through that period and not automatically pick up a cigarette or have that craving. So many of us, although we don't think of this as a vacation, many of us are behaving in ways that we would on vacation, right? We're not going into the office. Some of us are not even putting on real clothes. We're wearing sweatpants all day long. And so as a result, I'm actually saying this, I'm looking out my window at the apartment across the way, and there's all these like people walking across windows who are like wearing very skimpy clothes because they're just at home all day long, right? We are in these environments where all of our cues and rewards are kind of up for grabs, and that gives us the capacity to build new habits.
I like it. This is like the ultimate pattern interrupt that we've got right now.
That's exactly right. I mean, that's the whole point of a lockdown or a quarantine, right? Is to interrupt the patterns that normally make the transmission of disease very, very easy. And we are in a state where those are all up for grabs.
When we look at the CDC and the White House, not the president, as you're saying, and we see that maybe in whatever state we are, we should not be getting together as groups. How do we create a new habit when our mind is saying, but it looks like it's safe, it looks like it's all right? I've had professionals saying, tell me there don't appear to be any cases around here, so you can come out now.
Right. This is one of the reasons why that communication is so important, right? So let's take New York as an example. I'm in Brooklyn right now. Mm-hmm. One in almost every 500 New York City residents has died because of COVID. Right? So like if you went through the city, every 500th person you touched would just fall down dead. It's a huge death toll. Now, we don't see it, right? Because as soon as somebody gets sick enough that they're at risk of death, they're going into a hospital and they're essentially removed from our view. And what's interesting is under health laws right now, cameras really can't go into those hospitals. This law called HIPAA prevents the media from showing who's sick. So what we do instead is we rely, as citizens, we rely on Facebook, we rely on Twitter, we rely on numbers. And I think that it works. I think that many people realize, like, they could potentially be at risk, certainly elderly people. I can't even remember the last time I saw someone over the age of 65 walking down a New York street. And the best thing that we can do is we can just remind ourselves, this is real. This is something that if you are in a certain category can kill you very easily. And that's the best we can do.
How do we? So that's in New York City. I'm out here in Colorado, where we actually have statistically per 100,000 as high of a rate as almost anywhere else in the country. Our county, Eagle County, which was the first in the country to open up, has a very high fatality rate. And yet, it appears on the surface, everybody is coming out. This either isn't real, it isn't as bad, or depending on that social media, it's a hoax.
I mean, look, all you got to do is wait 3 or 4 months. I mean,
well, that's why we're having this show. Is I don't want people having to wait 3 or 4 months. I want to help them today, so that 3 or 4 months we're not in that situation.
Oh, we're going to be in that. I mean, that's not a choice. Like, I'd say two things. First of all, the number one thing you can do is wear a mask. And the reason why you should wear a mask is because, first of all, it cuts down on transmission of coronavirus. Second of all, it's a reminder to every single person that sees you that we are during a time when you should be socially distancing. Right? Like, the reason why masks are so important is because they send a signal. In addition to reducing transmission, they send a signal letting people know, like, look, stay 6 feet away. And it works, right? Most people. But the other thing is, like, honestly, so the influenza epidemic of 1918 starts basically in about February or March of 1918. And a lot of people die in the spring. And then summer comes and people start leaving their houses. The massive wave of deaths, the overwhelming wave of death happens in the fall. If you look at San Francisco is a perfect example. There's a wave of death in the spring of 1918. In the summer of 1918, they begin to reopen, and there's actually what are referred to as the mask riots. People start coming out. They refuse to wear masks. They congregate together. They have all these big, like, protests to show that they don't want to wear masks anymore. And then literally, something like a fifth of the city dies in the fall. So anyone who's watching, I mean, if you're watching this show, you're probably sensible enough not to go out there and to think that, like, you don't have to worry about this. But if you're thinking to yourself, I don't know anyone who's died, I think this might be less serious than they're making it out to be, like, just like on a whim, give it a couple of months. Because when we hit October of 2020, New York is going to be fine at that point. It's the rest of the country that's going to be dying.
How do we move past that American way habit? New Hampshire, live free or die, right there on the license plate. I don't want to have to wear this. Where in Asia, it is such a putting on a mask is such a statement of, I care more about you.
I don't think we do move past it. America's never done well with things like this, to be totally honest. Like, America is really, really good at like rushing headlong into things. Mm-hmm. So prior to World War II, America was something like the 17th or 19th largest economy in the world. We were not a superpower by any measure. And then the reason we became a superpower is because the rest of the world was essentially devastated by World War I and World War II, and because our ability in World War II to militarize and produce so much war material gave us a huge advantage over other countries. But America is not good at this stuff. Like, we're not good. We're not good at being patient and sitting on our heels and taking cautious steps. I don't see any reason why that would change. The people watching the show, they might be good at it, right? There are pockets of America who are really good at it. There's pockets of America that are great at making long-term investments and that are really great at choosing wisely for the future. But we're a young nation, and we really haven't been a superpower comparatively very long. If you were sitting back and we weren't American and we were making bets, the money would not be on the U.S. to come out of this pandemic in a great place. Other countries, yeah. Other countries have been through this before. They know how to suffer. America doesn't, and that's a strength and a weakness. But I don't think we change our national habits.
How do we then change? Let's talk for the last few minutes here, do's and don'ts for our individual habits.
For our individual habits, here's the thing that like people should be thinking about if they're at home. This is a huge opportunity, right? I think everyone realizes that on some level. Anyone who's at home with their kids, you're going to look back on this period of 5 years from now and think about like how much time you got to spend with your children. As long as we make it through this thing with our health intact, right, and without unduly suffering because of the economic hits. This is a huge opportunity. It's a huge opportunity to rethink how work gets done. It's a huge opportunity to rethink what we want to do with our lives and for changing our habits. And the number one way to do that is to sit down and look at your own life and try and analyze, okay, what are those parts of my life that I don't like? What are the habits that I wish that I could get rid of? And what are the cues and the routines and the rewards that are driving those? So, for instance, for many people, it's harder to exercise, I think, during the quarantine. And so a lot of people have been like looking for new ways to start exercising. Maybe they're running at a different time of the day previously when they were working. Maybe they're doing a different kind of exercise. I think the key is that you need to give yourself a reward for that. And those rewards can be really, really powerful right now because we have so few of them around us. But it is really important to give yourself a reward in order to allow yourself to enjoy some kind of new behavior. Otherwise, your brain is not going to latch onto it and make it more and more automatic. So if somebody listening to this goes for a run today, and they usually don't go for a run, even if it's a quarter-mile run, when you get home, give yourself like a piece of chocolate or like a nice long shower, or if this makes you happy, 20 minutes on Facebook or whatever it is. The more that you understand the cues and the rewards in your own life, the more you have power over your own habits and you have the ability to change them.
Which means it's also a perfect time to rip out the old and put in the new for our children and their habits as well.
Absolutely. Absolutely. Now, the one thing I will say is because I think a lot of people, on my podcast, How To, we hear from a lot of parents who are very concerned about how much screen time their kids are getting. And usually the concern isn't how much screen they've watched today. It's, are they establishing a bad habit in the quarantine that's going to ruin the rest of their life? Now, here's the thing. You really can be pretty easy with yourself and with others during this period. You really don't have to stress out about stuff because some of the bad habits that we're building, like letting our kids watch screens for, an extra 2 hours a day, as soon as quarantine is over, those are going to disappear. Like, again, habits are very, very delicate. They tend to disintegrate very quickly when the environment changes. And the environment is so unique during quarantine that if there's a bad habit that someone doesn't want to maintain, it will go away once the quarantine is over. So in addition to giving yourself rewards to create good habits that you can emphasize even after the quarantine and maintain, it's also okay to gentle and like pretty lenient with yourself. Because even if you're doing a couple things bad, and look, I'm having an extra half cocktail a night that I didn't used to have. Even if you're doing things that you don't want to be a lifetime habit, it's probably the urge for that is probably going to diminish once the quarantine is over.
Definitely, my screen time is up on reading all these things, trying to wrap my mind around the unwrap-aroundable. And so it's good that will change. 2 last quick questions. I know we got to let you go. First off, where can people go to find your podcast and find out more?
So if they literally just type into their favorite podcast player, "How To with Charles Duhigg," or even just my name, Charles Duhigg. I think even if you just type in Duhigg, I think it'll come up. And then if they want to find it online, it's distributed by Slate. So it's at Apple Podcasts and all of those things and Spotify. But you can also find it if you go to the Slate website, or if they just Google me, they'll find me online.
Thank you. So any last words of wisdom of how we either survive this pandemic or flip it, at least for our families and our community as best we can, on its head?
I think that the best advice I can offer is this: look, this is going to end. Before 150 years ago, infectious disease was part of human life, right? Before we had antibiotics, infectious disease was just something that happened all the time. Like, pandemics are not new or particularly even unique. They always end, and they usually end okay. And the key is just listen to what the sensible people around you are saying. Listen to what the scientists are saying. Honestly, if everyone wore a mask, it would reduce transmission by a huge amount. Right? Everyone watching this knows, like, when you go outside, it's not that hard to keep 6 feet distance from other people. It's the people who like thumb their nose at this that are most at risk. And they're probably not open to taking advice anyways. But for the rest of us, this is really an opportunity. It's an opportunity. I think if I came to you and I said, I'm going to give you 6 to 9 months vacation, you would be overjoyed, right? And it's not vacation. It's hard. It's hard. Everyone's struggling to work. A lot of people have lost their jobs. So it's not like that. But there are aspects of it that are like that. And you can take advantage of this. You can change your life by taking advantage of this quarantine.
That's how I look at it as well, as a bifurcation. You can go down the old way. You can go down the new way. Let's make the new way some way better.
That's right.
Thank you so much, Charles. This has been phenomenal. This has been fantastic. I want to wish you well and all the best, and thank you for all that you do.
Thanks for having me. Take care.
For everyone out there, this is Michael Sandler saying, be well, have fun, check out How To, and begin establishing better habits today, and shine bright. Woohoo! Thank you so much, Charles.
Thanks. Thank you. Take care.
If you're watching this, then you are a light worker. You're a light warrior, and I want to help. We offer everything from boot camps, mini masterclasses, full-on masterminds, and private one-on-one coaching with me. To find out more about our upcoming courses, simply visit InspireNationUniversity.com or click on the links below. And to find out more about coaching, simply visit InspireNationUniversity.com/coaching. We also have weekly YouTube live events with me where you can ask me your questions live, and YouTube premieres featuring me and our guests. Simply subscribe below and click on the bell icon to be notified of upcoming shows. I just had such an uplifting, inspiring, and hopeful interview on surviving the pandemic and coming out shining bright with Charles Duhigg on changing your habits. To check out more inspiring, uplifting, and changing your habits interviews, click here, subscribe below, click on that bell icon to be notified of upcoming shows, YouTube premieres, and live events every Sunday night with me. Be sure to check out our boot camps and mini masterclasses by clicking on the link below. Thumbs up if you like this. Leave your comments. Love you guys so much. Shine bright.